Assalamu alaikum class. We are going to start the last component of our subject, which is biostatistics, a very important subject. Definitely, you will get an SCQ from biostatistics in the SCQ paper, and 8 to 10 MCQs will come in the MCQ paper. One of the OSPI is set from the biostatistics section. This makes the core of the chunk which is taken by the external examiner. As I have already mentioned that the one component is research methodology, epidemiology, screening, and biostatistics. So the examiner mostly asks questions from epidemiology and biostatistics. So you have to be very vigilant while going through the lectures of this important subject. So, what are the learning outcomes of today's lecture are that we will be discussing different definitions which are related to biostatistics. We will be discussing the difference between descriptive statistics and inferential statistics. We will be discussing that what is the difference between data and information and how the data is collected from the sample and different types of sampling we have already covered. We'll just be touching that subject and then types of the data with which a biostatistician deals with. So, starting with my lecture, how do we define biostatistics? Biostatistics is a science of collecting data in which the researcher collects the data, he summarizes the data, he presents the data to show the information to the rest of the world, and he analyzes it, interprets the data, and accepts or rejects the null hypothesis. Fine. And he makes conclusions. So, actually, a biostatistician works in close collaboration with the epidemiologists and the researchers, in which he manipulates with the data which is collected by the researcher, and he manipulates the data in such a way that it summarizes it and presents it and concludes the hypothesis. And so they work as a team. So there are two types of statistics, as I have already mentioned, that descriptive epidemiology and inferential epidemiology. Descriptive epidemiology just describes the data, and inferential epidemiology is that epidemiology in which the researcher now wants to make observations or experiments to accept or reject the null hypothesis. In the same way, descriptive statistics is collected for the descriptive epidemiology, and inferential statistics is calculated for the inferential epidemiology. In the descriptive statistics, the data is collected, it is summarized, and it is presented in different forms. But in case of inferential statistics, data is analyzed, different tests of significance are applied, odds ratios, relative risk, population attributable risk, rates, ratios, proportions are calculated, and then interpretations are done. So they are very much interrelated with the epidemiology. So, when we talk about the descriptive statistics, you must think that how do we deal with the data in case of descriptive statistics. Descriptive statistics is divided into two components in which we deal with the quantitative data and we deal with the qualitative data. If we are dealing with the qualitative data, we present our data in the form of frequency tables. We present our data in the form of visual presentations, which may be bars, which may be charts, which may be line diagram, it can be spot maps, etc., etc. And if we are dealing with quantitative data means that we are dealing with the numbers. And while dealing with the quantitative data, we present our data in the forms of measures of central tendencies and measure of dispersion. We will be going through these components in our lectures. Okay. And in analytical statistics and inferential statistics, basically the biostatistician and the researcher analyzes data and they make conclusions. They accept or reject null hypothesis after the application of the tests of significance. Okay, let's move forward. Whenever we talk about biostatistics, we talk about population and we talk about sample. What is a population? The population data means the set of data. It can be numerical data or otherwise, which is collected from the entire collection of the unit. That is known as population. For example, if we want to conduct a study in the fourth year MBBS students of Lahore, then the whole population of fourth year MBBS students who are currently studying in Lahore will be taken as our population. And then from this population, as it will be not convenient for us to study the whole population, we will draw samples. So what is a sample? Sample is a subset of the population that are actually collected from the population, and they should always be representative of the total population. If the sample is not representative of the population, we cannot make conclusions, we cannot generalize our statements, and then we will not be able to make inferences. So the mainstay of taking a sample is that the sample should be representative, it should be large enough, and it should have all the characteristics of the population. Okay? So, this is the population which encompasses the whole area of interest, and this is the sample which is taken from the part of the population. If the sample is not representative of the population and it does not contain all the characteristics of the population, the results cannot be generalized, which are actually calculated on the sample. They cannot be generalized on the total population. So while making collection of sample, you have to be very vigilant that sample is taken adequately and it represents all the traits of the population. So why sample? Because it is difficult to study the whole population. It will be time consuming. It will be resource consuming. So we take a smaller sample, which is representative of the total population. We study all the traits which are important for us. We make conclusions, and then these conclusions are generalized on the population. We have discussed sampling in detail in the initial part of our discussion when we started our academic session, when we were making our synopsises, and we have discussed it in detail when we were discussing the methodology. Just to give a recap of what we have already done is that there are two types of sampling. Whenever we draw a sample from the population, we can do it in two ways. Number one is probability sampling, and number two is non-probability sampling. Probability sampling means that each and every individual or unit of the population has an equal chance of being selected into your sample. Fine. And this can only be done when you have a complete sampling frame with you. For example, if you want to take a sample from fourth year MBBS students, and until and unless you have all the roll numbers lists or attendance sheets of each and every college of fourth year MBBS student, you do not have a sampling frame. So if you have a sampling frame, it means you can do a type of sampling in which each and every unit of the population has an equal chance of being selected into your sample. But if you do not have the sampling frame, then there is probability that each and every unit of the population does not have an equal chance of getting into the population, which is known as non-probability sampling. So going towards the probability sampling, when you have a sampling frame, you can make simple random sampling in which you can use the lottery method, in which you will make the slips of all the individuals, and then you will actually fix the sample size, and you will draw those numbers as the lucky draws are done, and all those who will be taken out of that population will be included in your sample. Simple random sampling can be done by lottery method. Simple random sampling can be done uh, uh, by the use of computer generated random tables. It can be done by applying the color coding system, etc. So the simple random sampling is an easy one. Then we go towards the systematic random sampling. So in systematic random sampling, as we have already discussed, so I'm not going into details of advantages and disadvantages and the complete procedure. So I'm just giving you a recap that in systematic random sampling, what do we do? That in sampling frame, when the people are allocated, we take every nth number. For example, we will say that every fifth number or every seventh participant in the population will be included in our sample. Then the stratified sampling, in which stratas are made. For example, we want to make a sample of 100 and we know that 70% of the population is females in medical colleges and 30% is the males in medical colleges. So we will take a sample of 100 in which the 70 will be drawn from the strata of the females and 30 from the strata of the males. So equal chances and equal probabilities are calculated. Then we have cluster sampling, in which the geographical, on the basis of geographical boundaries, sampling is done. You make geographical boundaries on the basis of provinces, on the basis of districts, on the basis of rural areas, union councils, and then mohallas and streets, and then by the process of again simple random sampling or systematic random sampling, you will take sample from the cluster sampling. um, from the clusters. Going towards the non-probability sampling, if the researcher just wants to go and collects data, he goes in medical colleges and whoever is available of fourth year MBBS, he will collect the sample and come back. This is known as convenient sampling. Consecutive sampling means that once the data has been started to collect from a sample, whoever comes into the sample will be included in the sample and nobody will be missed. For example, if you are collecting data of the patients who are presenting with scabies in dermatology, OPD, then one fine Monday morning you start collecting data on a sample, and every patient who will come and report with the scabies will be included in the sample. This is known as consecutive sampling. So moving further, purposive sampling, this is also known as quota sampling, in which the quotas are made as the stratified sampling. Stratas were made, but now the type of sampling which is done on the basis of convenience or consecutive sampling. That's why it is known as purposive sampling. So, for example, if somebody wants to conduct a study on the sexually transmitted diseases in the transgender population, then he will only target it the gender population. So it will be known as purposive sampling, and the technique which will be used in this will be non-probability sampling. And the last type is the snowball sampling, in which the uh, researcher starts investigation with the sensitive topics and he identifies one person and he collects the data, and then this particular person gives information about the next person. For example, if you want to work on commercial sex workers in Lahore, you have to identify one person. After collecting data, you will ask him to identify another person, and then after collecting data from the second person, he will give you the information for the third person. So in a way, a snowball which is generated with a very small nidus keeps on growing until and unless the researcher wants to stop the data collection. So I have quickly gone through the types of sampling because we have discussed them in detail. I have given lectures on types of sampling. I think we have taken 3 lectures. So it was just to give you a recap. The detailed discussion has already been done in the class. So a researcher actually identifies a population, he takes a sample, he knows what is the sampling technique he has used, and then he collects data on the sample. So what is a data? A data is a set of values of one or more variables which are recorded on more than one individuals. For example, you all know that when we were developing our synopsis, we have developed the questionnaires, and these questionnaires were have to be given for the collection of the data. Either they were self-administered questionnaire or the interview-based questionnaires were designed. Fine. So these questionnaires have many variables, and for each subset of the sample, for each unit of the sample, you have to collect the information for all those variables. And when you collect information on those variables, this means you have collected data. So data is defined as the discrete observations of attributes or events in a sample. So when you collect data, now you have to transform this rough data which has been collected into the information. The difference between data and information means that data is a rough or raw estimation in which you have collected the information regarding variables, and now you want to convert it into meaningful information to be conveyed. For example, when you want to check the height of school children in Manga Mandi, you will go there and you will check the height of each and every individual, and you will record it. It means you have collected data. But once you will come back, you will collect this data, you will summarize it, and then you will say that the mean height of those students was um, this centimeter. Fine. So you have converted data into information, because the listener will not be interested in knowing the height of each and every individual. He will be interested in knowing the mean height of the individuals. So you have converted the data into information. So what are different types of data? There are primary data and secondary data. When the researcher goes into the field and collects the data himself, this data is known as primary data. And sometimes the data is already present, and the researcher just um, changes or manipulates the data to get the desired results. And this data has been collected from somebody else. This is known as secondary data. For example, I will give you an example. If we go to the office of rescue 1122 and collect the data of road traffic accidents ourselves, and um, we will be collecting secondary data, because the data is already present in their registers, and we will be deriving that data which is important to us from the registers. Another example can be that if we want to collect data of the road traffic accidents from the Farooq hospital, again it will be a secondary data, because the data is already present in the record room of all those who had accidents and have taken care in the Farooq hospital. But once we will go and we will take required information, it will be known as secondary data, because the data has been collected by somebody else. But if the researcher goes and collects data himself, for example, if we go and we spend our time near Canal Road of Lahore, or near Mall Road of Lahore, or Tukarniaz Beg, and then we will be collecting information of each and every road traffic accident which is occurring there, we will be collecting primary data. Ideally, primary data is of much more importance, because the researcher knows that what is the objective, and he collects the data in a very systematic and idealized way. But the secondary data is also very important, because we generate many rates, ratios, and proportions on the basis of the secondary data which is available. We have data which is collected by the Pakistan Demographic Health Survey. We have data from the NADRA, and we calculate health statistics on the basis of that secondary data. So it depends that who has actually collected the data. If researcher has collected it himself, it is primary data. If the researcher has collected the information or the data from the already collected data from somebody else, is known as secondary data. Then there are further subcategorization, qualitative data and quantitative data. As the name is suggestive, the qualitative data means we are interested in qualities, and quantitative data means that we are interested in quantities. For example, if we are interested in knowing that what is the hemoglobin level in grams per deciliter, we are interested in quantitative data. But if we are interested in knowing that this particular person is anemic or non-anemic, this is qualitative data. It means we can further change the quantitative data into qualitative data and qualitative data into quantitative data. For example, if we are taking age in years, then it will be quantitative data. But if we will categorize age, that all those who were less than 25 years, all those who are between 25 to 50 years, and then all those who are more than 50 years, we have divided the data, quantitative data, into categories. So we have converted it into qualitative data. Giving you further examples of types of data, as I have already mentioned that it is divided into qualitative data, and the qualitative data means this data is also known as categorical data. In qualitative data, we are dealing with qualities. For example, if we say that what is the gender of the participant, whether he's a male or he's a female. So it's a quality. We cannot give number to it. Whether they are educated or non-educated, it's a quality. Whether they are healthy or they are diseased, it's a quality. When we are dividing the qualitative data according to the names, this is known as nominal data. Fine. So the first thing is that you have to think that whether you are dealing with numbers or you are dealing with qualities. If you are dealing with qualities, it means you are dealing with qualitative data or categorical data. In categorical data or qualitative data, if you are dealing with the names, for example, male, female, educated, non-educated, diseased and healthy, fourth year MBBS students or final year MBBS students, students of Akhtar Said Medical and Dental College or students of Rashid Latif Medical College. It means you are dealing with names. This data is categorized as nominal data. Another type of data is known as ordinal data, which is uh, which is a subtype of qualitative data. And in ordinal data, we deal with the order rank. For example, if we say that we want to conduct a study in a population of Akhtar Said Medical and Dental College for MBBS students, in which we want to assess that what is their perception about their teaching methodologies, then we have to take sample from first year, second year, third year, fourth year, and final year. And this is an order that the final year student will have much more information as compared to the first year MBBS student. And now we have ordered them according to their year. Another important example which I can give you is that, for example, a researcher wants to find out that what is the political affiliation of the people who are residing in a specific area. Then he will be dividing them into uneducated, primary pass, middle pass, metric pass, um, inter pass, graduate, and masters. Because the master, that person who has a master's degree will be far better in opinion than a person who is illiterate. So whenever we are dealing with a categorization in which categorization is done on the basis of superiority or inferiority of the grade, this is known as ordinal data. Going towards the quantitative data, which is also known as numerical data, in which we are dealing with numbers. If we are dealing with whole numbers, it is a discrete data. For example, the number of children a female has can be 4, but it cannot be 4.5. For example, the total number of days which are spent in academic activity can be 100, but it cannot be 100.5. So if you are dealing with the whole number, you are dealing with discrete data. And if the data has some decimals into it, it means it is a continuous data. For example, the mean hemoglobin concentration is 12.3. The serum cholesterol level was 200.67. The thyroid level was 3.42. So whenever we are dealing with the decimals, we are dealing with quantitative data, which is continuous data. Fine. This categorization should be very clear in your mind, because all the basis of biostatistics are based on the categorization of data, that with which data you are dealing with. If you are dealing with qualitative data, you will do this. If you are dealing with quantitative data, you will do this. If you are dealing with qualitative data, the presentation will be this. If you are dealing with quantitative data, the presentation will be this, etc., etc. If you are dealing with qualitative tests, the test of significance will be this. If you are dealing with quantitative data, the test of significance are these. So there are always, the first question which comes with the in the mind of the biostatistician is the type of data. So moving forward, you have to see that what do we understand by discrete data. If the data is in numbers and there are no gaps between them, it means there are no decimals in them. And the continuous data, there are no gaps between the possible value. The value can be 1.32, 1.3345, 1.367, etc. So in points you can get the data, and in continuous data there is no gap possible between the values. But in discrete data the gaps are available and only one value, numerical value, is given to the observation. So this is the assignment. You have to identify the type of data for these data set. Number one is hemoglobin levels in grams per deciliter, number of children in a family, educational level of students studying in a medical college, serum cholesterol level in bankers, walking habits in elderly population, and ratio of successful students to fail students in an exam. You have to identify the data. Initially you have to identify that whether it is a quantitative data or qualitative data, and then you have to give the sub categorization of that particular identified type of data. So this is your assignment. If we go towards the continuous data, it is again further subdivided into ratio scale and the interval scale. The ratio scale is that scale in which the true zero value is present. For example, the actual measurement scale, which starts from the value of 0 and it goes on to the infinity. But the interval scale means there is no true 0 point. For example, whenever we talk about the human body temperature, we take it in Fahrenheit as 32 degree Fahrenheit. We take it as the 98.6 degree Fahrenheit, or we take the human body temperature in centigrades as 37 degrees centigrade. So usually there is no true 0 point, because a human body cannot present with 0 degrees centigrade temperature. So in interval scale, no true 0 point is present. But in ratio scale, true 0 point is present and it can extend from 0 to the infinity. But in interval scale, no true 0 point exists. So how do we collect data? Where there are different methods of collecting the data. You can conduct experiments, you can conduct observational studies, you can conduct cross-sectional surveys. We have discussed them in detail. What are the methods of data collection? You all know that we can collect the data by using the questionnaires. We can make survey tools. They can be online tools. We can go and check records. We can conduct interviews. So all this helps us to collect the data. So this concludes my lecture number 1 of biostatistics. If you have any questions, you can ask me. Time for submission of assignment is um, from now onwards up to 15 minutes only, and no late assignments will be accepted. If you have questions, I will be happy to answer them. Thank you so much.